A really warm welcome to you today to this webinar of the National Centre of Excellence in Intellectual Disability Health. My name is Julian Troller, the Director of the National Centre. Today's webinar is about insights and opportunities using the NDDA to improve healthcare for people with intellectual disability. We're so pleased you could join us. I would like to acknowledge the Bidjigal people, the traditional custodians of the land here at UNSW Sydney, and I'd like to acknowledge we're coming to this webinar from the lands of many different First Nations people across this great country. I want to pay my respects to elders past, present and emerging, and to First Nations people present today. I'd like to acknowledge the importance of cognitive disability to our First Nations communities and acknowledge the importance of the work of the Centre in that space. I also want to pay my respects to people with lived experience of disability and those who support them, including people present today. This webinar is to really help us all think about this new asset and think how we could use and benefit from it. We would welcome your questions as we go. Please type them into the Q&A and we will see if we can answer them as we go. We'll get a recording of the webinar to you with a link via email as soon as we can after the session. And if you're having any difficulty accessing today's webinar, please do reach out to Tyler. Her email address is on this slide, t.lockwood@unsw.edu.au. We'll do our best to help you. I'm just going to play a little video which will tell you a little bit about the centre before we get started with our main event.
Hello and welcome to the National Centre of Excellence in Intellectual Disability Health.
We call it the Centre for short. This centre makes sure people with intellectual disability get better health care.
At the centre, we talk to people with intellectual disability to find out what they think is important.
We talk to families and support people.
We work with health services and disability groups.
We bring information together from across Australia.
We share information about how to make good health services for people with intellectual disability.
We make sure there is health information for people with intellectual disability, families and supporters, health and disability workers.
We speak up on the big health issues and drive positive change.
There are 9 main groups in the centre. We call this the consortium. There are also more than 50 wonderful partnering and collaborating organisations. People with intellectual disability are a big part of the centre. People with intellectual disability work at the centre.
We're excited about improving the health and well-being of people with intellectual disability. Please join us.
To find out more information, go to our website nceidh.org.au and sign up for our news.
Welcome to the centre.
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 Yay!
So if you'd like to know more, you can use this QR code to sign up and understand more about the centre, or you can email us. A warm welcome to the centre and to this webinar. Just a little bit about the National Centre. The National Centre of Excellence in Intellectual Disability Health is funded by the Australian Government, Department of Health and Aged Care. It comes about because everyone has worked hard to make sure that our government understands the health needs of people with intellectual disability and is responding to them. It's part of the implementation of the National Roadmap to improve the health of people with intellectual disability. It's a partnership between 9 consortium members and 56 partnering and collaborating organisations. Together, we've co-designed an initiative that helps to make sure that all people with intellectual disability have access to the healthcare they need. The centre has its administrative hub here at UNSW Sydney, but the work is done all over the country in our many collaborating organisations and consortium members. We have a really rich work plan and activity list that hopes to build that next step in healthcare for people with intellectual disability. We're co-designing aspects of a better system, and we're really excited to share that work. You can join us in so many ways, including in a conference that we have coming up in July. Today is a really exciting day for us. I would like to introduce our speakers today. I'll be speaking shortly, but I'd like to introduce Catherine McAlpine, who's the CEO for Inclusion Australia and Community Co-Chair of the National Disability Data Asset. Catherine is a respected leader in the disability community and has extensive experience. She's also, as I said, the community co-chair of the NDDA, so she has special insights into how it's working and can tell us all about it. I'd like to introduce Luke Nelson. Luke is a self-advocate who's been active in the disability sector for more than half of his life, for 18 years so far, and he currently holds professional roles at Inclusion Australia and Valid. And it's great to have Luke presenting and sharing his expertise today. So welcome, Luke.
Thank you, Joanne.
We also have Louise York. Louise is the head of Community Services Group at the Australian Institute of Health and Welfare. Louise works to improve data collection and reporting about people with disability with the aim of improving outcomes for people with disability. And it's very exciting to have you as a presenter today, Louise. Thank you for sharing your expertise. We also had planned to have my colleague Prepron Sasakrin, who's head researcher here at the National Centre of Excellence in Intellectual Disability Health. Unfortunately, Prepron has had a medical emergency today and needs urgent help. And so she's unable to be with us. She sends her apologies. But the good news is that I'm able to present her slides on her behalf, and I'll do that a little later. So first, I would like to speak a little bit about how data helps us improve the health of people with intellectual disability. I think we need to understand first what is linked administrative data, because this data is central to the National Disability Data Asset. This is data that is combined information obtained by connecting de-identified information from individuals from different administrative data sets, for example, government or other agencies. It creates a more comprehensive data set when it's combined, and so it helps us improve our data analysis. If used properly, it can be really valuable in decision-making, in policy, in shaping the services and funding of those services in the future. The National Disability Data Asset is one example of linked administrative data. We've seen a lot of progress in the capacity to link and understand data in Australia in the time that I've been a researcher and a clinician. We started with input that just shaped a single data set. So we were collecting information from one agency and able to look at that. We then went to a phase where we were able to link more than one data set, but we had to do that each time we needed to look at those data sets. And that involved a lot of ethical approvals and a lot of person power to individually link those data sets each time we needed to look at them. We've now gone to a new time of third generation data assets. These are where the linkage occurs routinely, is then preserved for ongoing use, and involves many, many linkages brought together. An example is a National Disability Data Asset, and another example, which is important for us in the health field, is the National Health Data Hub. So what is the NDDA? NDDA is governments, that's state and territory governments and the Australian government, working together with people with disability to make sure that there's access to these linked administrative data sets. Together, we're shaping what should happen with those data sets and partnering with people with disability to make sure that the data is used wisely and for the benefit of people with disability. You can read more about that on the NDDA website. Some advantages of the approach taken by the NDDA is that it helps us identify people who may otherwise not be visible in our systems. Sometimes, and I'll illustrate this later, people only appear as and identify as having a disability in one type of data set. And so this means if we're looking at another one, even though we know a person has a disability types by a certain type in one place, we don't see them represented in another, even if they've been a user of that service. Another advantage is that we get a comprehensive cover and a large sample size, giving us these population level insights and higher power to understand their meaning. It also helps us because we don't have to burden people by asking for individual consent when we use the data, because it's de-identified. We don't know who we're particularly talking about. We just know some of their characteristics that help us in that analysis. The access this way is more cost effective. We're able to look at lots of different health issues and how different attributes of that person come together to shape their experience. And it tells us about the real world, how people are using services. There's great potential then to think, how do we do the services better? How do we have funding that's appropriate? How do we have a better services system to meet those needs that we've identified? And that, of course, has implications for how our health and other services systems run, and for policy and new initiatives. Over time, new data sets can be added, and this adds to the richness and what we're able to achieve using those data. Of course, in the intellectual disability space, we realise addressing health inequalities is a very, very complex task, or can be very complex. So we must make sure that we do this well in a co-designed manner, with the priorities being set in partnership with people with disability. We must make sure we partner with all of the stakeholders, and we must make sure we gather lots of different types of data. An analysis of the linked data in the National Disability Data Asset is one important example of how we could proceed. How we benefit is that once we've done that problem identification, we can undertake the analysis. We can then come back to our stakeholders and design a solution to the problems that we see from the analysis. We can change policy and practice, and then reevaluate and continue to upscale to improve the health services and to see its impact. The results can lead to real-world improvement. An example is some of the earlier work we did to understand the early death for people with intellectual disability on average compared to the general population, and then understand the reasons or the cause of death and potentially avoidable causes of death, and the factors then that made it more likely that a person was to die helped us then work with the Quality and Safety Commission for the NDIS to then say, okay, this is what we need to do to try and prevent those deaths. So that's a real world example of how this can benefit the lives of people with intellectual disability. So it's now my pleasure to offer the slide control to both Catherine and Luke to present their segment for today's seminar. Over to you, Catherine and Luke.
Hello, everyone, and welcome to today's webinar. Our presentation is about the National Disability Data Asset. In this presentation, we will call it the data asset for short. We acknowledge that we are all joining from First Nations lands around Australia. I am joining from the Wurundjeri country in Narn, Melbourne. We pay our respects to elders past, present, and emerging. That respect to any First Nations peoples joining us today. We recognise self-advocates who have worked very hard over the years for equality and human rights for all. My name is Luke Nelson. I've been active in the disability sector for the past 18 years, and I am a policy officer at Inclusion Australia. I'd also like to introduce Catherine McAlpine, CEO of Inclusion Australia and the co-chair of the NDDA. We are the National Disability Representative Organisation for people with an intellectual disability and their families. We bring people together through our members to support and advocate for people with an intellectual disability. Why data is important. Why we need the data asset. How data is different. What the data asset will do and not do. Last year, I attended an NDDA workshop about engaging with people with disabilities. I learned that good data is important. Good data can help with things like helping people advocate for laws, policies, and services that work well. Good data can also make the experiences of people with disabilities, make sure the experiences of people with disabilities are at the center of decision making. So I know data is important, but why do we need the data asset? Catherine?
Good question, Luke. Why do we need the data asset? Well, one of the big reasons is because there's not much data about people with disability in Australia. especially about the different types of disability and their outcomes. So, for example, in 2020, Inclusion Australia asked Deakin University to collate recent data on people with an intellectual disability living in Australia so that we could give that information to the Disability Royal Commission. But it turned out it was really hard to find that information because there wasn't data in one place that was put together on people with disability. Well, even on people with disability generally, let alone people with an intellectual disability specifically. There were different ways intellectual disability was defined in the data collection in the research, and the data wasn't there over a long time. And there was limited or no publicly available information about the numbers and characteristics of people with intellectual disability accessing government services administered by the Department of Social Services or the Department of Education, Skills and Employment, or Aged Care. So that meant we couldn't even find out basic information like how many people with an intellectual disability go to special schools, or how many people with an intellectual disability are in open employment. We couldn't find that basic, what we would have thought was basic information. Now, there is more information, and Louise is, of course, from the Australian Institute of Health and Welfare, and they produce a report annually called People with Disability in Australia. And this includes national data, but national data only. So there's a lot of missing data as well. For example, there's a lack of information on what services people with disability use, and that is both mainstream services like health or specialist services like the National Disability Insurance Scheme. It doesn't have information about the contact people with disability have with the justice and child protection systems. We know, for example, that a lot of parents with an intellectual disability end up having children removed, but we have very little data on that. There's little data on the use of restrictive practices such as seclusion and physical or chemical restraints. There's not much information about people with disability in what we would call closed and segregated settings, and people with communication support needs. There's not enough information about key life course transitions, such as from school to further education and employment. There's not information about the unmet need for services. What we mean by that is the people who need services but can't get them because they're not available in their area or they don't know how to get them. And that would be both within the NDIS and outside the NDIS. There's no information on the immediate and long-term impacts of natural disasters and emergencies on people with disability. The quality and sustainability of the disability workforce. We know that people with an intellectual disability need a lot of support, need specialist supports, but we don't know enough about who the people are and where they get those supports. There's issues around supported decision-making. Where can people with disability get support for decision-making? And for example, what is the extent that people with disability are represented and supported in legal proceedings and decision-making processes? And something that Julian's done a lot of work on, causes of death of people with disability, and such as potentially avoidable deaths. And these gaps largely result from issues with existing data, such as inconsistent definitions of disability, or barriers to data sharing, or data about disability not being collected at all, which is the case for many mainstream data collection. And one of the things that we've said over the years, for many people or for many systems, they didn't even think about people with an intellectual disability, so they didn't bother counting them. And so therefore the data doesn't exist. And that's really important. Back to you, Luke.
Thank you. In the community, I hear people talk about wanting to keep their data safe. I know one of the reasons is that when data is used in the wrong way, it can cause harm. I know that people talk about the robo-debt scheme, for example? Can you please explain more, Catherine?
Well, what happened with the robo-debt scheme is very complicated, but in summary, tax and Centrelink data was linked, and it was linked for the purpose of working out that if someone was working, they were trying to work out that if someone was working and receiving a payment from the government, whether or not they'd been overpaid. So, for example, that might have been someone who works and also receives a disability support pension. Computers were used to decide if someone had been overpaid over a period of many years. But the problems were that the computers used the wrong information sometimes. No people reviewed the decisions made. It was just the computers. Letters were sent out by the government telling people they needed to pay back a lot of money. It was hard for people to show what money they earned years ago. And people at risk, such as people with disability or people experiencing homelessness or unemployment, or both, were the main people affected. And this caused a lot of stress for people who received the letters. People were made to feel like criminals. So a lot of this is written down in the Royal Commission's report. The Royal Commission found that the robo-debt scheme was illegal, and it contained many recommendations about improving data linking programs and what we call automated decision-making, which is decision-making made by computers and not by people. Luke?
Yep.
Can we just go back to how do we make the data asset make the data better?
Yes, we can. Yeah. Yep. So how can we make the data better?
So the gaps in the data are really big, especially for people with intellectual disability. And the National Disability Data Asset has done a lot of thinking about how we know if the data, how do we know if the data that different parts of government has is about people with disability? So Julian just explained that before, about how different parts of government have got information about people, but sometimes they don't know if that person has a disability. And so a lot of this work is what we've called about the disability indicators, or these are, another word is to say flags that show that that data is about people with disability. So the very first set of information that's come, or the first set of indicators that have been established, are about disability-related government payments and services. So these indicators include people who have been taken part in the NDIS, or people who are eligible for or received a Centrelink disability support pension, or their carers, like they have carers related to them that were eligible for the Centrelink care allowance, or some other Centrelink payments. But this doesn't represent all people with disability in Australia. Not everyone has the DSP or is part of the NDIS. So what are the limitation of the disability indicators? And the data from the first disability indicators was compared with other data from the 2022 survey of disability ageing and carers to give an idea on how well the indicators included different groups of people with disability. The indicators didn't cover didn't cover all the people with disability in Australia. It didn't cover older people, people with disability with low or no need for support, or people who have paid for support through private means or for private disability support services. Community and disability experts all work together to develop the disability indicators.
So how is the data asset different? How do we make sure that people are kept safe and the data is used properly?
And that's a really big question, because that's a really big fear in the community. Hey, Luke?
That's right. There's a massive fear that data could be leaked, or because not many people well, I suppose anyone doesn't like giving over their private information. Yeah, so there's a massive fear, isn't there?
That's right. So people want to know that it's safe. And so after Robodebt, the people with disability had a lot to say about whether or not their data was going to be linked. And one of the things that was decided that the data asset would be co-governed with people with disability and the wider disability community. And that means that governments and the wider disability community share responsibility and decision-making for making the National Disability Data Asset. And the data asset was set up in consultation with data experts and people with disability through the disability representative organisations. And they worked out a strategy and a structure to make sure the data asset is co-governed through the NDDA Council, the council panels, the NDDA Charter, and my role as the community co-chair. So when we look at the council is made up of 12 people, and 3 of those people are from the Australian government, and 3 of those people are from state and territory governments, and 3 people are disability, have a data expert. So experts are people who know a lot about something. So in this case, Julian is one of the experts because he knows a lot about disability data. And 3 disability community members who are mainly people with disability and family members. So the rules are that one of the disability community members and one Australian government member are the co-chairs of the council. So the council co-chairs are the 2 top photos you see on this slide. So first of all, there's me. So I'm the CEO of Inclusion Australia. And the person next to me in glasses is Luke Mansfield from the Department of Social Services. So Luke is Group Manager in Disability and Carers at DSS. And the other people on the council, the community people, are Giancarlo De Vera, who's a community member, who's LGBTQIA plus and a culturally and linguistically diverse person with an invisible disability, and is in carer of other people with disability. We have a new person who's not pictured, and that is Shalard Daniels-Mays, who's not in the photo, but has just joined as a community person. Our experts are Professor Bruce Bonahady, OAM, Disability and Data Expert Member and Executive Chair and Director of the Melbourne Disability Institute. Rosemary KS, who's the Disability Data Expert Member and, of course, the Disability Discrimination Commissioner. And Professor Julian Troller, Disability and Data Expert Member, Chair of Intellectual Disability Mental Health, Head of Department of Developmental Disability, but most importantly, running the centre that is hosting this webinar today. From the government, there's Marion Hales-McDonald, State Government Member for Western Australia, and Gemma Van Holderen, PSM, who's the Australian Government Member from the Department of Social Services. She's the Chief Data Officer. And Duncan Young, who's an Australian Government Member, who's the Chief Data Officer and Head of Health Economics and Research at the Commonwealth Department of Health and Aged Care. And Carly Northcote is a State and Territory Government Member. There are other people who have contributed to the work of the data asset, and they include Dr. Scott Avery, who's the former Community Council Member, Professor of Indigenous Disability at the School of Public Health, University of Technology, Sydney, and research partner of the First Peoples Disability Network, and Dr. Philip Gold, who's former Australian Government Council member, previously the Chief Data Officer and First Assistant Secretary for the Health Economics and Research Division at the Commonwealth Department of Health and Aged Care. And we've met 6 times in 2024, and we've held 2 workshops. So it was a pretty busy first year. So what does the Data Asset Council do? Our responsibilities is to make sure that the NDDA is used appropriately. So that means putting into place things that make sure the data is only used for purposes that meet community expectations. So the council makes recommendations to the disability ministers around the strategic direction of the National Disability Data Asset and how insights gained from the NDDA could be used to improve outcomes for people with disability. While this sounds very influential, and in many ways it is, the council is actually not the only decision-making body within the existing rules about the data asset, and I'll talk about this in a minute. One of the most important things that the council aims for is to build trust with the community because of those fears that you talked about, Luke, and also to report on progress. So the council aims to build trust in the National Disability Data Asset with people with disability and the wider disability community by publicly reporting on its use and benefits. It meets quarterly and gives public updates on its decisions, and it will also publish an annual report, and a summary of that report will also be available in Easy Read and Auslan. So this slide shows what the council does and does not do. And one of the most important roles is decisions about who's on its advisory panels. So the council can set up panels and to share ideas on important topics. So they're a little bit like subcommittees in other governance situations, but they're expert panels. And one of the most important ones is what we call the Disability Informed Ethical Oversight Panel, or just the Ethical Oversight Panel. And that panel will review project proposals with a disability perspective. The panel will only recommend projects to be approved that are not likely to cause harm to people with disability. And the panel will develop a framework to guide consistent assessment of project proposals seeking to access data from the National Disability Data Asset. And one of the most important parts of the co-governance is the document called the Charter. And it helps people understand how to use the data asset. It was made by people in the disability community. And between the people on the council and the Charter, it'll help people make good decisions about the data asset. And it makes sure that everyone uses the data asset in the right way. The Charter has principles and new rules. The principles say how the data asset should work. For example, it must include people with disability, have information that is accessible, help people with disability, and keep data safe. Everyone has to do what the Charter says, even the council and even government departments. So this helps to stop the government deciding to use data for a different reason. The Charter has rules about what people cannot do with the data asset. So the data asset cannot be used to share personal information about people. It can't be used to decide if a person can get government assistance like Centrelink or the NDIS. It can't be used in a way that breaks the law. It can't be used in a way that does not help people speak up about their rights. And it can't be used by a computer to make sure people follow rules, like the rules to get government assistance. Luke, I think you know what the Charter says, what the NDDA can be used for.
Yes, that's right. The Charter says that the NDDA can be used for research. Research means finding out what people think about things, using the information to help others. The data asset can only be used for research that looks at how to understand people with disabilities, programs to help people with disabilities, how Australia helps people with disabilities speak up about their rights. The data asset can only be used for research that looks at making inclusive communities, help people with disabilities to find services, help everyone understand about people with disabilities and, and their family supporters. The last point, the last part of our co-governance is the role of the co-chair, which is you, Catherine. Can you tell us more about this role? Over to you.
Thanks very much, Luke. As I mentioned earlier, the co-chairs of the council are one disability community member and one Australian government member. And it means that the government can't make all the decisions by itself. It also means that it's really important for me and the other disability community members to talk to people with disability and their representative organisations all the time so that we know what the issues in the community are and the community knows what advice we are giving the NDDA. One of the interesting things is I think people think because I'm the co-chair that I get to make more decisions than I do. So, for example, it's a government's decision about who's on the council. I can't decide who's on the panels by myself. That is a whole council decision. I can't make any council decisions on my own because they're council decisions. And I'm not allowed to talk to the council about issues that are not connected to the data asset. And so just to finish off, we just want to say again that the data asset cannot be used for automated decision purposes or determine or influence an individual's payments. The data asset cannot be used for the other things that we mentioned before, including sharing personal information about people. What the data asset will do is in early 2022, the disability ministers agreed to the first three data priorities. And the first three data priorities the asset will focus on are the reporting on the outcomes under Australia's disability strategy, focus on health outcomes for people with disability, and employment outcomes for people with a disability. In the future, the asset will also include government information on early childhood development, school education, housing, employment, and other topics.
That brings us to the end of our webinar. Thank you for joining us today. Are there any questions from the audience?
Thank you, Luke. Just as chair, I would note that our time for this slot is tight. So what we might do is save all of the questions right to the end, if that's okay, because we have another 2 talks as part of the webinar. So it's great to hear directly from you and from Catherine all about why we need the NDDA and how it's different to some other approaches to data and what it will and won't do and how it will benefit people with disability. Thank you both for sharing your expertise. It's wonderful to hear. We're next going to hear from Louise York. You may remember that I introduced Louise earlier. Louise is the head of Community Services Group at the Australian Institute of Health and Welfare. Louise works to improve the data collection and reporting about people with disability with the aim of improving outcomes for people with disability. Louise is going to tell us about how the National Disability Data Asset will help us and how we got here to this point of having it, what's next and how we can access it. So it's a really exciting presentation Louise is going to deliver. So Louise, if I could welcome you, it's over to you and I will help by progressing your slides. If I can just check that you're there. Yeah, lovely.
Oh, I'm hoping I'm here. Can you hear and see me?
I can, and I have your slide up. I will just progress to your first slide.
Excellent. Thank you very much. And thank you, everyone. Thanks for the excellent presentations already. And apologies, I'm having a very strange technical day today. I'm joining on my phone and I'm muddling through, but I do hopefully have some interesting points to share with you today. So if we could move to the next slide, Julian, I would like to start by acknowledging the traditional custodians of the lands on which we are all meeting. I'm joining you from beautiful Ngunnawal country, which is Canberra, and I'd like to pay my respects to elders past, present and emerging, and particularly extend that to any First Nations people on the call today. So Julian's already mentioned that I'm going to walk you through some information about what is the National Disability Data Asset. You've already heard lots about that today and how it will help, and a bit about how we got here and what's coming next, including how you can access the data asset if you would like to. So the data asset brings together data from most aspects of our lives and the services we access. So it covers things like disability services, health, social security, education, employment, housing and justice services. And it's a really important initiative under Australia's disability strategy, and it will aim to really improve both information about and for people with disability and outcomes for people with disability. And as we've been talking about, a really important feature of the asset is the way it's co-governed with people with disability. Ultimately, it should have about 200 different data sets going into it. And the information about people in the asset, though, all of us are in the asset actually, will be de-identified. So, and it can only be used for the purposes that Catherine and Luke were just talking about. Next slide, please, Julian. The key purposes or the initial purposes that we're focusing on are, as Catherine just mentioned, firstly to help reporting against Australia's disability strategy, and then to look at health outcomes for people with disability and employment outcomes for people with disability. So we've talked a bit about this already in the webinar about why we need to link data together to get a better understanding. People with disability have historically been quite invisible in a lot of data that's collected to understand population needs and outcomes. And, when we're accessing most services, we're rarely, if ever, asked about whether we have a disability. And this means that government reporting also can't be broken down by what it means in terms of outcomes or service use for people with disability compared to people who don't have disability. And so in government, people often say that the data are siloed and they're all separated. And so different agencies have a view of different aspects of our life. So they might know us as patients of the health system, or clients of the child protection system, or tenants of the housing support system. But it's through data linkage that you can really start to bring some of that information together in a de-identified way, so that doesn't have our names and addresses attached, and start to look at how we, as groups of the population, move between different services and what outcomes we achieve. So next slide, please. So that means there are some really big benefits of the data asset. For the disability community, there are some really good benefits through co-governance and inclusion in how the asset's being built and delivered and how it's going to be used. And then there'll be some excellent insights, new insights about the experiences of people with disability in Australia. Be really good benefits also for researchers because they'll have access to much better data. and they'll also be delivering that data in a much more disability inclusive way, so drawing on expertise in a much more coordinated way than we've had in the past. And of course, there are benefits to governments in terms of better disability reporting and service and policy design. So thanks. In terms of the history of the NDDA or the data asset, it started with a pilot that ran for 18 months to the end of 2021. And it involved the Commonwealth Government plus 4 states. So New South Wales, Victoria, South Australia and Queensland. And my organisation, the Australian Institute of Health and Welfare, was the technical lead. So we were involved in bringing the data together. And we were joined near the end also by the Australian Bureau of Statistics, because we really need all of these different players to bring the data together. And in that pilot, we linked over 50 data sets and created these new derived cohorts of people with disability or people with disability in the different data sets. And that's what Catherine was referring to as the disability flags. And through that pilot, we learned quite a lot of new things from 5 test cases that were conducted by multiple different people, and they were working with state governments and people with disability and different research organisations. And those 5 test cases covered early childhood justice, education to employment, mental health and housing. So what did we find from the pilot? Using those disability flags and a whole range of different data sets, the housing test case found that people with disability were 8 times more likely to live in public housing compared to people without disability, 5 times more likely to access specialist homelessness services than people without disability, and 3 times more likely to receive Commonwealth rent assistance. In the mental health project, they found that 9 out of 10 people identified with disability in Victoria used mental health related services. They also found that the mortality rate was 5 times higher for people with psychosocial disability in the National Disability Insurance Scheme in Victoria. In the early childhood test case, they found that less than half of children identified with disability in New South Wales had accessed a disability or early intervention support by the time they turned 7. And they also found that 1 in 3 children in New South Wales out-of-home care placements were identified as having a disability. In all of those cases, there was much better data than we had had before in finding people with disability. So it was a much closer estimate of what was happening for people with disability. And I mustn't forget the education to employment test case that was done in South Australia, which was able to look at what happened to young people after they'd finished school in the next couple of years in terms of their education or employment outcomes, and found that students with disability in South Australia were 26% less likely to enrol in university and 20 to 26% less likely to find employment by the age of 25. Okay, so that was the pilot, and we've since moved on, and in late last year, in December last year, 2024, we released the first version of the ongoing data asset, the National Disability Data Asset. We have 18 data sets now available for use and the first generation of the new disability flags. The data in the asset at this point includes data from the National Disability National Disability Insurance Scheme, Medicare data, so about our use of GPs and specialists, medical specialists, data from the Pharmaceutical Benefits Scheme, so about medicines that we get through the pharmacy, information about deaths, information about income support, survey data from the ABS Survey of Disability, Ageing and Carers, where people are asked about their experience of disability at the population level, and information from South Australia's hospitals. In a couple of months, we will expand that first data set to include more information on hospitals, some information about disability services that were delivered before the National Disability Insurance Scheme, so we can look back at what used to happen, more information on early childhood, and information on applicants to the National Disability Insurance Scheme. And then, as Catherine mentioned earlier, we'll be continuing to expand the asset to include information about housing, child protection, youth justice, immunisation, education, aged care, and more. And as we go, we'll continue to enhance the disability flags. So next slide. Thanks, Julian. We've said quite a bit about these, and I think the key point to note is that the first disability flags have been designed in consultation with people with disability, and they cover people who are or participating in the National Disability Insurance Scheme or receiving income support payments related to disability. And while they don't cover all people with disability, they are better than anything we've had before. And so we need to continuously improve those flags and also make sure that we really carefully describe their limitations. And so we'll be making lots of information available about that. Next slide. So how is this all going to improve what we know about intellectual disability and health? I thought I'd focus a little bit on what we call the NDDA Central Analytics Team is doing. So this is a group of people who work at the Australian Institute of Health and Welfare, where I am, and the Australian Bureau of Statistics. And they're analysts who have a lot of experience in working with and an interest in working with disability data. And our job is to work on a work program that the NDDA Council sets. So that's the co-governed council. And some of the key things we'll be working on over the next 12 to 18 months are improving or developing intellectual disability flags. So a way of trying to find the best information we can about people with intellectual disability in the data we have. And we'll do that with people with disability. We'll also be supporting researchers to access the data asset, and we'll do that by providing the best information we can about what we know about the data in there. And then we will be looking at a whole lot of different questions using the data available to help understand a whole lot of new things about how people use health services and what outcomes they have. So I've put quite a lot of questions on the slides, but some examples are that we will know for the first time how many people with disability you go to the emergency department, how many are admitted to hospital, what are they there for, how long did they stay, what do we know about different uses of going to the general practitioner, what do we know that, to our GP, what do we know about use of different medical specialists like cardiologists, is that does that look right for people with disability compared to people without disability? Does it look fair? We'll also be able to build on some of Julian's work on causes of death by looking at a whole lot more information about the types of causes of death that for people with disability, including things like suicide. So this is all coming and will be, for the first time ever, will be available for a group of people with disability and ultimately for people with intellectual disability to really start understanding the use of health services and what it means for outcomes. Next slide. Thanks, Julian. So for people interested in accessing the data asset, I've put the website link on the page and also the email address for the Australian Bureau of Statistics, who are coordinating all access, responsible for all access to the asset. So the very easiest thing to do to start with is to email that email address there, and that will start the process of connecting you with the people you need to talk to. If you then want to put in an application to access the data, there's a request system so that you can find through the NDDA website. And following that, the ABS will review your application to ensure that it aligns with the NDDA Charter and other legal and governance commitments. Then the application will be reviewed by data providers, such as hospital data providers, if they have requested that. At the same time, it will be reviewed by the Disability Informed Ethical Oversight Panel to avoid harm to people with disability from the proposed research. And then once those things have happened, if approved, the data can be accessed via a secure data lab, and any data leaving that secure lab is checked by the ABS to make sure that it is confidential, that it is not possible to identify an individual in the resulting data. And then finally, and this is a good feature of the NDDA, all findings must be published in accessible formats and added to the NDDA website so that they're fully transparent. So finally, I just wanted to close with the way all of our data is kept safe through this process. So the National Disability Data Asset includes measures for keeping data safe across 5 areas. Projects must be for research that's within the acceptable uses that have been agreed through the Charter. The people accessing the data must come from an accredited organisation, and that means an organisation that has met certain criteria or rules through the legal arrangements that are covering the data. The data can only be accessed in these secure settings that I was talking about, these secure data labs. The data that people can access can only be the data they need, and it is fully de-identified, so it doesn't include any names and addresses, and has been carefully treated so that people can't be identified through other means. And the outputs are then all checked before they're allowed to leave that secure environment to make sure that nobody's identifiable. So that's enough from me, Julian. Thanks for everyone for listening.
Thank you so much, Louise. It's been wonderful to hear the history, how the National Disability Data Asset is built, what it contains now and in the near future, and then how we can access it, and the importance of the safety and the checking process with that access, and then finally how the results can be released. Thank you for overcoming a number of hurdles, difficulties today to present such a rich presentation for us. And I'm sure there'll be some questions at the end for you. We might move quickly to the presentation that was going to be done today by my colleague, Associate Professor Priyapon Sasapkun, who's a Senior Data Analyst and Head of our Research and Data team for the National Centre. Unfortunately, as I mentioned earlier, Priyapon is unable to be with us and we wish her well. We're going to talk a little bit about the activities of the National Centre and how it will support the engagement and understanding of the National Disability Data Asset. And Priyapon has outlined that we carry funding from a range of different sources that we need to declare that has helped us in this journey with our data. And we need to acknowledge particularly funding sources from the National Health and Medical Research Council, which has really helped us to do a lot of work in the data space. And we have to acknowledge data custodians, including our New South Wales Ministry of Health and the New South Wales Centre for Health Record Linkage, the Australian Institute of Health and Welfare, for all working together to help provide us some data to work with. And we acknowledge the Independent Health and Aged Care Pricing Authority for providing us with information about diagnostic codes that we can see in the health data sets. Priyapon was going to present about how we identify people with intellectual disability and some research insights, how we're looking at the work of the centre to support the engagement with the National Disability Data Asset and some future plans for her team at the centre. And so what about identifying people or identifying groups of people, not individuals, through linked data? We began this journey some time ago when linking data and bringing things together wasn't common. And it literally was a process that required someone to write some script to merge data and then de-identify it. And from that, we understood the importance of bringing data sets together. And the data sets we brought together were community mental health data in New South Wales and disability data in New South Wales. This is well before the NDIS. And we published that and realised that people with intellectual disability required very substantial community mental health services support. And that encouraged us to look further and think, what else do we need to look at? We brought together a large group of people across our state in New South Wales, more than 50,000 people with intellectual disability. And when we brought them together, we needed to bring together lots of different types of data to be able to look at the whole or a population capture. And when we brought together key data sets like disability data, data from the hospital, from emergency departments, we saw that we were able to see different proportions of that overall group in those different data sets. And we used that in a number of different ways to look at health outcomes for people with intellectual disability. But you can see in this slide that in only about a third of individuals in the data set were they recognisable in each of the data sets that we were looking at. So that told us that there's essentially, as Louise was telling us, a siloing in these data sets. We went another step further and expanded our linkage, and this expansion meant that we were capturing what we think is close to the whole population in New South Wales of people with intellectual disability. And you can see the proportions of their representation in the different types of data sets. The big diagram on the right-hand side is really just a picture of the number of different data sets. You can see there's, how many are there? 9 or 10 data sets there in different domains of disability health, corrective services, and other data sets. And those data were also linked to data that told us about outcomes, including deaths and cause of death. And we're able to look at the health and wellbeing of those groups. We then went one step further and expanded things further. And our next step was to bring together many of those data sets, but also a group of matched people living in New South Wales. So matching a big group of people in New South Wales for age and sex and where they lived. And this was helpful because we were then comparing people who were matched on those factors in the general population with people with intellectual disability living in New South Wales. And so we were able to look at many different outcomes for those two groups and how they differed. We had quite a big group of people. We had about 450,000 people who were the matched control group, and we had just over 100,000 people with intellectual disability in New South Wales, and they were well matched. And I will talk a little bit more about that. Well matched, of course, because they were matched on age and sex. But of course, when we looked at the age at death, this was different for those two groups, even though they were well matched on the other characteristics, including things like socioeconomic status, which is a big determinant of how early in life you pass away. So what about the work of the National Centre and how it's helping us? Well, Priya Paul was saying her involvement is as part of the technical working group for the disability indicator group, subgroup that she's part of. And she is advocating there to use multiple different data sets to identify people with intellectual disability because we've seen its value in our own work. If we could just illustrate that in a more substantial way, in one of our linkages, we looked at people with intellectual disability in prison. And we were able to identify a group of people with intellectual disability in prison. But you see that this diagram just shows where the data has come from and how those people are represented differently in the different data sets. We were able to identify about 457 people with intellectual disability at that time in prisons. And that showed us that people with intellectual disability were overrepresented by 4 times the expected rate in New South Wales prisons. But it also told us that we weren't able to accurately see who is a person with intellectual disability in prison unless we brought all of those data sets together. So you can see that really well from the data set here. In fact, what was striking here is that about 43% of people were only identified when they entered prison. And so that told us that there was a mechanism there that was working well to identify that group within prison, and that they weren't very well represented in those other data sets. We also followed the course of the person when they came into and then went out of prison, and we saw a number of very interesting things. We saw that providing disability support and mental health support for those who needed it after they left prison was important in keeping them out of prison. It reduced likelihood of return to prison very substantially. But we also saw that some of the identification of whether the person had disability didn't follow them once they left prison. And this was important because, of course, understanding more about the person enables you to provide the right types of support for that person once they leave prison. One of the things we've done is to look at whether people are recognised with disability within the health system. We found that when people came to have an episode where they're admitted to hospital, that only 1 in about every 4 or 5 times that the person was admitted to hospital was the intellectual disability accurately coded. And this was a very important thing, which told us really if we were to look at the health needs of people with intellectual disability, if we only looked at the health data, we'd only be seeing a very small proportion of people's needs. And so again, it just emphasised this siloing. We also saw that the likelihood of being identified with disability reduced over time, and that was a concern for us. So what about future plans for the research and data team here at the centre? Well, We are really keen to use our knowledge to estimate the number of people with intellectual disability in Australia using the National Disability Data Asset, and to determine accurately their health needs. What are the common conditions and how they come together? What are the conditions which are common co-occurring conditions? What are the rates of death and potentially avoidable deaths? And how do we understand whether a person is able to access the health care that they need with the data? And I've put Claire Pawn's details here in this slide. And if you'd like to ask some questions for her, she'd be more than willing to hear about them. And it's my pleasure now just to wrap things up, to talk a little bit about future directions and the use of the National Disability Data Asset, and hopefully to leave a few minutes for some questions and then wrap up and close. We need to understand how we could best use the data from a number of different perspectives, from the perspective of people with intellectual disability, from the perspective of what needs to be done next in healthcare, thinking about things like the national roadmap to improve the health of people with intellectual disability. But also we need to understand the key drivers of some aspects of disability and health support. The Australian Disability Strategy has an outcome area 6, which is all about health, and their policy priorities 1, 2, 3 and 4 are very important. We need to ensure that service providers have capacity to meet the needs of people with disability. We need to understand that prevention and early intervention should be accessible to people with intellectual disability, that mental health supports and services are working, and that we have adequate disaster preparedness and management. And that has been especially important in the times of recent natural disasters and, of course, during COVID. The Disability Royal Commission and the findings there related to this area said that we really need to work on a nationally consistent approach to data, making sure we have the right disability identifiers or flags in the services that support people with disability, and the underscored the importance of the National Disability Data Asset. We also have what's called the National Health Reform Agreement, which is a key document which essentially dictates what happens next in our healthcare system and what we're going to measure in that system and what we're going to fund in healthcare. And the National Health Reform Agreement really is a place where we can make sure that the health needs of people with intellectual disability and the needs around analysis of data are represented. We've done a lot of work in the past in this area in regard to deaths. We're doing work looking at cancer incidents and end-of-life care and comparing causes of death in different systems. We've done work related to hospitalisation and emergency department presentations and costs. We've done work looking at how people are represented in their local government area with intellectual disability. We've produced a way of local health districts understanding the health needs and use and costs associated in local health districts in a portal that we developed for local health districts. We've done work looking at how people are recognised in the services systems, how people are recognised in the justice system, and how knowledge about them influences whether or not they return to prison. We've done some work with colleagues at the Kids Institute in Perth around gastrostomy in younger people with intellectual disability. And we've done work looking at the impact of sex on health services access for people with intellectual disability using our data sets, which have been linked for us by those agencies I mentioned. We've also looked at different groups, people with mental health needs and people with different neurological conditions, to understand those groups as well. And we've done a lot of work in this space of developmental disabilities, including people on the autism spectrum. Currently, we're looking at things like how common particular diseases are, how common conditions that could be prevented are, whether or not having ongoing care and particular types of care help us with our health outcomes, the impact of having a mental health issue in combination with intellectual disability on overall health and outcome. We're doing work looking at medicines use in people with intellectual disability and potential harm associated with the use. We're looking at service use cost and what predicts how someone might use a health service. We're looking at more work in the justice system, more work about deaths, and we're working hard to make sure we know how well to identify, how to identify people with intellectual disability well, and what data sets we'll need to do that. There are many, many gaps in this area. We have gaps about the how and gaps about the what. The gaps about the how are really how we do co-design well in data projects. This is something we need more understanding of, more research about, and more capacity in. We have limited researcher capacity in this space. People with the skills to do this sort of work on data are very rare. We need more of them. We need to train more people in these sort of methods. We need to develop new methods, and we need to understand the latest in the way data is being used in other areas to bring benefit to people with intellectual disability. In the what column, there's a lot of information. We need to make sure that we understand more about dental and oral health, prevention of illness, mental health and how to best manage and support a person with disability. We need to know much more about medicines use and harm. A neglected area is frailty and the end of life period for people. Another neglected area is the health needs of those in rural and remote settings. We need to understand and work with First Nations people to prioritise their needs and to work out what their health needs are. We need to understand better the complexity for some individuals. People who have lots of different needs in different areas are often the people who miss out on healthcare. We need to understand that using the data to make sure that we develop better models to support that level of complexity. And of course, there's how the systems interact to best support a person that we need to, I think, understand. So for the next steps, I would like you to consider how could you engage with the National Disability Data Asset? How could you share your understanding of priorities? How might you be involved as a researcher, if you're a researcher, and what we should do next? You can visit the website for further information. You can subscribe to the National Centre of Excellence in Intellectual Disability Health newsletter. And of course, we would very much value you staying on Zoom to complete the post-webinar survey so that we can understand more about your needs to share information about this and other initiatives. We have been very fortunate today to have wonderful expert speakers, Luke, Catherine, and Louise, and I'm really grateful to them and to Prairporn for putting together her slides. I would really like to thank our Auslan interpreters, Susan and Cornelia. They've done a fabulous job, thank you. I would like to thank Tyler from the National Centre of Excellence in Intellectual Disability Health and Down Syndrome Australia, who's worked tirelessly to make sure that this works today. And I'd like to thank you for attending today. A reminder, before we go to questions, please stay put to sign up for your, do your survey. So now we've got just a few moments for questions, and I will just go to the Q&A, and I'll see that there are a number of questions. And I'd ask all of our panelists perhaps to, if they can, appear back for us. and to be ready to answer questions. The first question is, are we considering utilising ambulance data? I'd be interested to find out ways to support. And there's a great thank you, Amber, for the link to Ambulance Victoria. I think it's a very important data set. We know from our data in New South Wales that people come more often to hospital using emergency services, including ambulances. Louise, do you know the answer to that? Are you on mute at the moment? Still muted, I think.
Okay, thanks. I know we're very interested in bringing ambulance data into the National Health Data System. So there's lots of interest in that, but it hasn't happened yet. So I'd be very happy to have follow-up conversations.
So watch this space. Thank you for the link, Amber. That's fantastic. Maria has asked the question, is the data dynamic and will it help us identify where people with intellectual disability are currently engaging with health so we can target those specific areas? So how kind of dynamic is it, or is it intermittently linked, Louise?
Okay, so it will be linked annually at this stage, but you will, but within that, it will be all of the records for the year. So while it won't be as timely as we'd all like yet, and I'm sure that will improve over time, it will be ongoing. If that makes so it'll be you will have a continuous record at the person level of all of their different access over time.
And as you say earlier, it goes back as well in time. That's the build. And that's, to be frank, annual updates is excellent. We have worked with data that becomes years old, even after we get it in the past. So I think this is a great step forward. Thank you. Don asks, is there work on pain management of people with intellectual disability, especially in the NDIS space? This is problematic with support workers and other non-clinical staff assessing and responding to pain and distress. I'm not aware of any work in the data space in that area, Don, but there is work in other areas of research and equipping staff to better understand people's experience and how they express pain. Catherine, I'm not sure if that's something you would like to comment on through your awareness of the disability sector.
Oh, thanks, Julian. Yes, it's a real problem. Oh, am I there? Yes, sorry. Yes, the issue of recognition of pain is a real problem where people, it's sort of like if people don't behave properly, and I'm not even talking about behaving badly, we have plenty of examples where people have presented with quite significant problems like not breathing properly or possibly broken bones. And because they're not expressing their pain in the way that other people do, people say, oh, they're not experiencing any pain. And that is so not true. So absolutely, we would say that would be something that would be worth exploring, but don't know whether that's helpful, Julian.
Thank you. And I'm aware that our time is nearly finished. I wondered if I could give the last word to Luke. Luke, how do you feel today's gone? Is there any closing comment you would like to make about the importance of the National Disability Data Asset for people with intellectual disability?
Thank you, Julian. Data is very important because we need to know what is happening within the disability community. We need to know, or the data experts need to know where we're going in the disability community. We need to know about aging. We need to know about healthcare. We need to know about what significant disabilities are out there. So I think I'm a big believer in the data asset, and I'm very fortunate and very lucky to do this job. Very fortunate and very lucky to serve my community in the way I do.
Thank you. And we've been very fortunate to have you, Catherine and Louise, present to us today. We're very grateful that the audience has joined us. Thank you, everybody. We look forward to sharing the recording with you when it's available. Bye for now.